Thank you, everybody. I appreciate you coming today. I'm Chris Hunter. I'm the Director of Health Services, and one of our divisions is the Mosquito Control Division for Orange County. What I'm going to go over is some details about the Zika virus in general, maybe try to dispel some myths or misrepresentations you might have heard, and talk about what we know so far about Zika. I'm also going to talk about the mosquitoes that transmit it, and again, hopefully try to dispel some myths and give you a better understanding of why the control methods we're going to talk about are so important and unique to this type of mosquito. I'm going to go into some details about what Orange County Mosquito Control has been doing up to this date for those travel-associated cases of Zika and just suspected cases that we've seen. And then I'm going to go into the plan of what we would do if we were to have local transmission here in Orange County, so that everyone here understands what the process would be, and hopefully we can all see where our roles all are. So how did we get here? It's probably no big surprise to anyone in this room that Central Florida is an excellent breeding ground for mosquitoes. Mosquitoes require warm weather and they require water, and lots of both. And it turns out that we're pretty good at that. Mosquitoes lay their eggs either in or very near water, and they require water to go through their larval and pupal stage before they're born into biting mature adults. We know that we have issues with mosquitoes here, and Orange County Mosquito Control has been part of the process of disease and vector control for many years, so we're not new to this. We're very well aware of it. So let's talk about Zika very briefly. Zika is what's called a flavivirus. It's an RNA virus that's enveloped. From a scientific standpoint, that probably doesn't mean much to you guys, but it means a couple things to the medical community. One is that it's related to dengue and chikungunya, which are two other arboviruses that we already are well aware of, that we've already been in a process of controlling, and the symptoms are pretty similar to them, much milder, to be honest. What it means also, which helps us, is that flaviviruses are fairly easy to test for with laboratory examinations that we have now. That's not to say it's not complicated, but through things called PCRs and ELISAs, we have the ability to test urine or blood and be able to detect the Zika virus very quickly. So when we started with this issue of Zika in our hemisphere, the laboratories that we know that were up to speed were able to test for it very quickly, and now we even have commercial labs able to do it. So it's very easy to test for. That doesn't sound like much, but you can imagine in the case of a virus that's difficult to test for, it becomes much harder for us to screen for the illness in groups of people. So that's a good news aspect of Zika. So the transmission of Zika is mainly through the bite of an infected mosquito. And we're going to go over that again and again, that's the most important aspect of transmission. But we also know that it can be transmitted from maternal to fetal, and this is where the big dangerous issue that's made Zika such a threat to us has come in, because infected perinatal and prenatal fetuses have developmental difficulties with their brain tissue and can be born with something called microcephaly, which we'll discuss in a little bit. It can also be transmitted through sex. It's not identified as a sexually transmitted disease because that is not mainly how it's transmitted, but we know that Zika can unfortunately be transmitted through unprotected sex, and that's part of where the CDC rules and guidelines come in when we talk about that a little later in the talk. It could technically also be transmitted through a blood transfusion or an organ donation. Many blood banks are testing their sources now for Zika. In fact, One Blood here in Orange County, our largest source, has started doing it over a month ago. So it's something that they make sure that they're looking at before they give blood that could be donated to someone else. And finally, like many other infectious diseases, it could be spread through a laboratory misadventure if someone were to somehow get it in their bloodstream while testing it in a lab. But there's never been a case of that happening as of yet. So Zika virus is not new. In fact, it's probably quite old. It was first identified in 1947 in rhesus monkeys in a forest in Uganda known as the Zika forest, which is where it's got its name. In 1952, it was first isolated from a human being, so it was the first known human to be infected by the virus. And over the next 50 years, the virus spread fairly unchecked through sub-Saharan Africa and parts of Asia. And the reason for this is that the symptoms were very mild. And compared to most arboviruses, dengue, chikungunya in particular, which are very severe illnesses, sometimes life-threatening illnesses, Zika seemed to be the least of most people's worries. It was a mosquito-borne illness that most people didn't even feel that they had or knew that they had. In 2007, there was a massive outbreak in Micronesia, French Micronesia, and an island called Yap, where they found almost 70% of the population had been infected, and it happened very quickly, and that kind of massive spread was a little bit shocking how fast it happened. In 2014, Zika came to the Western Hemisphere for the first time. It was isolated first in Chile, and then in 2015, there was rampant spread throughout Brazil and up through Central America. And we all know now in 2016 that it has been transmitted here in the continental United States just several weeks ago for the first time. Just so you know, the way these viruses spread is not necessarily through the mosquito when it comes to these crossing continents. It's because people, right? As we became a more global society, as we started traveling from point A to point B, infected people could travel to places that had the same type of mosquito, then those mosquitoes would then transmit the illness. And that's why these illnesses can be such a threat to us here in Central Florida. So Zika is, as I mentioned, clinically quite mild. You might have low-grade fever, some muscle aches. There's a known conjunctivitis, which think about pink eye, essentially, kind of crusty pink eye. But the vast majority of people that get Zika actually have no symptoms at all. That's good for the patient. Nobody wants to be sick. But it's bad for epidemiology because it makes it very difficult for us to track who's sick and who isn't. When we first were concerned about Ebola, there were some actual positive aspects when it came to epidemiology, which was as horrifying and scary as the disease was, it was fairly difficult to get, and once you got it, you got sick almost 100% of the time. So you couldn't have been exposed and start exposing other people before you got sick. Unfortunately, with Zika, that's not the case. You can have the virus and be able to spread it without ever even knowing that you were sick, which makes it very difficult from a public health perspective. The issues that we found with Zika, actually, and as I mentioned, no one really cared much about it until 2015, when evidence came out that fetal infection was linked to microcephaly. Microcephaly simply means small head. It's just a description, and there's a lot of things that can cause microcephaly, but it is usually, unfortunately, linked with really significant developmental delays and sometimes fetal demise. And they found this link, which has now been shown and repeated several other times. And now there's even been laboratory evaluations showing the virus can penetrate into the neurons in a developing brain and show why this might be linked to the virus. So there's really no argument anymore that Zika virus, when you're infected, when you're pregnant, may become devastating to the fetus. And that is the big concern. There are other ways Zika could be dangerous. It has also been linked to something called Guillain-Barré syndrome, which is a neurological issue where people can have a temporary paralysis, where if you're not treated, could be fatal. There's a lot of other viruses that cause this, and in a place like the United States, where we have a pretty sophisticated medical community, Guillain-Barré is rarely fatal. The big issue here is the link to microcephaly and developmental delay. So symptoms occur within 2 or 12 days after you become infected, you become bit. And they usually only last for about a week. One of the questions that comes up a lot that we don't have great answers to is how long can you continue to transmit the disease to mosquitoes or sexually? And the answers to those are still being thought out. One of the problems with Zika being so new to the scientific community, and that people weren't spending a lot of time focusing on it for the first 50 years we knew it existed, was that we didn't spend a lot of time figuring out these little things. How long are you infected? How long does it stay in your bloodstream? To the best of our knowledge at this point, you are infected for about 2 to 3 weeks afterwards, and that's why after you've had a positive test, we ask people to remain away from mosquitoes for 2 or 3 weeks. Sexually, it appears it could be transmitted from men to females for almost 2 months. So the CDC recommendation is that those people who travel to Zika endemic areas do not try to conceive, particularly if the male has been there, for at least 2 or 3 months to practice safe sex. So there's 2 difficulties in this, and that we're still figuring out the time period. Blood and urine can be used to test for it. The urine tests are new, and that makes it a lot easier for the public health departments because it's a lot easier to get people to give a urine sample than to get a blood test from individuals, so that is nice. Currently, there's no treatment and there's no vaccine. So it means right now the best way to avoid getting sick is to protect and limit exposure. And for the most part, that means limiting your exposure to the bite of infected mosquitoes. So obviously, that becomes an issue for us because we have the type of mosquitoes that can spread this virus. Not only do we have them in Central Florida, we have them year-round. If you look, I don't have a good laser here, but these orange areas are where Aedes aegypti and Aedes albopictus are year-round. So the yellow areas are where they can spread during the warmer months. Some of these yellow areas here are yellow that way because they are above 6,500 feet. And in the mountainous areas, this mosquito just simply doesn't thrive. But you can see the state of Florida is nice and orange there. When we look at where Aedes aegypti and Aedes albopictus are year-round, you can see the southeastern United States, including Florida. We know we have these mosquitoes here. And we also know as a tourist center that we have people traveling from these parts of the world up to us very, very frequently, whether they are coming as tourists or they are family members or any other cause. So we have a lot of people traveling from those areas. And unfortunately, we have had issues with travel-associated, it's not working, there we go, travel-associated Zika infections. So this is as of August 15th. I didn't want to go up to today because the numbers change fairly quickly, but as of Monday of this week, There were 413 travel-related cases of Zika in the state of Florida. There's also 57 infections involving pregnant women. Those are counted separately by the Department of Health for reasons that are not necessarily clear to me. So technically, it was a 470 total. And we've also had 28 non-travel related cases. All of those non-travel related cases have come from this 1 square mile area in Miami-Dade, the Wynwood neighborhood, which many of you have heard all about on the news. So this is the first case of local transmission in the continental United States. It occurred several weeks ago. And what happened was that there were 4 original cases, symptomatic adults. And what that did was kind of bring the Department of Health and the CDC cavalry in. And what they started doing is what's called seroprevalence testing. They started meeting with the individuals that had the positive test, asking about their travel history, finding out they did not have any, and then talking to their family members, their loved ones, where do they work, where do they go, who do they interact with, and where else might they have spread the illness, and they start testing those individuals, and you start the domino effect. That domino effect ended up catching an additional 24 patients as of Monday, all of whom weren't asymptomatic but positive for Zika. So you could see these original cases were linked to these other cases. Who was infected first, we will probably never know necessarily. The Department of Health went down there in force. The CDC sent an emergency response team there. Between the two, they've been combing these areas and working with Miami-Dade Mosquito Control to try to limit this exposure. And as of right now, they have limited it very much to this one small area. And I think it's important to recognize that. This has been several weeks, and while we continually are having these trickle of new cases come in, what you're not seeing is spread throughout the Miami-Dade area or South Florida. And it shows that by pouring these resources into the problem, they've been thus far able to isolate the outbreak. The CDC also gave their first travel warning ever for pregnant folks inside the United States to another area inside the continental United States. So that was a pretty big deal. And basically they said, if you're pregnant or thinking of becoming pregnant, avoid this 1 square mile area, which is the first time they've ever done that. So these are the culprits. This is the Aedes aegypti and the Aedes albopictus mosquitoes. And there are some things that we ought to know about them. So these 2 mosquitoes are very well adapted to the urban environment, right? They don't live in lakes, they don't live in ponds, they don't live in marshes. They're not out there going after animals and cattle and deer. They feed almost exclusively on humans, and they breed almost exclusively near humans in small containers, mostly containers that we have created ourselves. They're very well adapted to living in urban environments, and that's what makes them so difficult to treat. They bite during the day, again. They're mostly after humans, and that's when we are mostly out and available to be bitten. And they're very difficult to control. And as I mentioned, the reason is because of where they breed. These mosquitoes look for small containers of water, particularly artificial containers, although there are natural sources of them. And they can breed fairly quickly during the hot, rainy season. In just about 7 days, they can go from egg to biting mature adult if it's warm enough and it's wet enough to do so. So the issue comes to how do you get rid of these areas? And these are things, the natural causes of stuff like bromeliads or holes in trees, to man-made issues like tires and containers. One of the things that people don't think often of are the gutters that you might have on your house. You have to make sure the water is flowing. If your gutters have been clogged up, a small puddle is forming in there, they will breed in that gutter, and you can dump everything else and not realize they're actually breathing a couple feet above your head in your gutter. There's also can be issues in storm drain and pretty much anywhere where small, shallow amounts of water can collect for several days at a time. Another interesting aspect about this particular type of mosquito is that they don't travel very far. Again, they're urbanites, so they usually don't go far from where they're born. I give the example of my house. I'm willing to admit we have had these mosquitoes in my yard. I've had mosquito control, and despite the fact that I know exactly how to get rid of these mosquitoes, to me it shows evidence of how hard it is to control this population, because we still did have some. And what we learned, and what we now kind of preach, is knowing these mosquitoes only go about 150 yards from where they're born. They're basically as a diameter around from where they're born where they'll go. So if you have these mosquitoes on your property, they are breeding very close by. In our case, they were actually breeding in one of our neighbors' yards, just one door down in a bird bath that we now wash out every week. But we weren't even aware of it because we were controlling all the water near our property and not thinking about it. So it's important to recognize that if you have these mosquitoes, they're breeding nearby, and that by being good neighbors, by being good stewards of our property and working with those people that we live near or work nearby, you can avoid the possibility of the mosquitoes going from one place to the other. It also shows you it's not these mosquitoes flying from here to Miami or Miami to here. It is the people who have the illness that are coming from areas that are infected and then getting bit by the mosquitoes we already have here. The mosquitoes don't go far. And this is just an example. This is an older slide, but it shows our surveillance for Aedes aegypti and Aedes albopictus mosquitoes over a longer period of time, a couple years ago. And not surprisingly, we find these mosquitoes where we find the people, right? If you look at this map, this is where we find the people, right? The most urban sections of our county. You don't find them out in the wetlands. You find them in the neighborhoods. You find them where the people are. So very important to keep that in mind. So we combat the idea of any disease-carrying mosquito vector through the Orange County Mosquito Control Division. Orange County Mosquito Control is a year-round operation. We're not seasonal. We're year-round. We're working all the time. It's been in existence for a long time. Again, Zika is the new kid on the block when it comes to the viruses, but when it comes to mosquito-borne illnesses, this has been an issue that we have thought about and worked with for years and years. In fact, Aedes aegypti and Aedes albopictus mosquitoes are kind of one of the #1 culprits we've been after for years and years because of our concerns about dengue and chikungunya, which are spread by the same species. So we're not new at mosquito control, and we're certainly not new at targeting Aedes aegypti and Aedes albopictus mosquitoes, and we've been doing it for a while. So hopefully that gives you some confidence that we've been working for a long time on this. We have a budget of just over $2 million, staff of 30. We anticipated having a busier summer this year, and that has absolutely been the case. And we were able to bring on a number of seasonal employees, and that has helped us quite a bit because we're going to talk about how you combat these mosquitoes, and you'll recognize how much manpower that actually takes. And we maintain a fleet of about 18 vehicles. So what do? We do surveillance and abatement, essentially for disease vectors, and there's a number of different ways we do that. Orange County Mosquito Control goes on scheduled and unscheduled visits to certain properties, areas that we know are hotspots that we need to check, and also areas where we get phone calls from citizens, from businesses, also where we were notified by the Department of Health that they have a concern with a suspected case, and we go to those areas and perform surveillance. We do surveillance by trapping and identifying either adult or larvae or eggs. Then we destroy breeding habitats, which mostly means getting rid of standing water, and we can also use anti-mosquito materials. So adulticide are materials that will help us destroy the flying biting, mostly females, those are the biting mosquitoes. And the larvicide is materials that will help us get rid of the larvae if they're already in water before they can be born. We also collaborate very strongly with the Florida Department of Health. The Florida Department of Health helps us send off mosquitoes for testing of illnesses, of the virus if they're carrying it, and they also help us determine which spots we need to go to when they have a suspected case, which we'll talk about in a moment. So our control techniques with surveillance, our trapping can be either sophisticated or not very sophisticated. On the right side there is called a BG trap, and that's a fairly sophisticated trap. It essentially has a lure that smells like a human, and it emits some carbon dioxide and basically draws in the mosquito because they think they're going to get a good meal. On the other side is something called the little black jar, which is literally a container with a little bit of water and a tongue depressor in it with a sheet of absorbent paper, and essentially just provides a great breeding habitat. And if we put them there and the Aedes see it, they like to come lay their eggs. If they lay their eggs, then we can take them back to the lab and see, yes, this is an Aedes aegypti or Aedes albopictus mosquito. We know that they're in that area and we can focus on it. So the main thing we do is destroy breeding habitats, and that's the most important thing I should say we do. And that sounds simple, but it's actually very difficult, the dumping of standing water. And again, every 7 days when that water accumulates, there's the reality that the mosquitoes might breed again. So it's a constant struggle to do that. The other thing we do is encourage everyone to wear barrier protection, particularly protection with DEET. And I want to emphasize the fact for someone who is pregnant or wants to become pregnant that DEET has been shown to be safe in pregnancy. There's always concerns about that, and it is unfounded. You can still wear DEET. Clothing is an important thing, long sleeves, long pants. It's not very fun to wear that in the summertime in Florida, but it's a great way to protect yourself. Also utilizing screens or air conditioning in your car, in your home, and where you sleep. I mentioned before, this requires manpower and public engagement. It seems so simple, but it is actually quite difficult to maintain an entire community that continually does this. Our other control techniques, when we talk about these materials, we use fairly sophisticated adulticides and larvicides. It's important to recognize that this is not the best way to control these materials. We talk about this with our elected officials and with everyone else. You can't spray your way out of Aedes aegypti and Aedes albopictus because they fly during the day and at night they hide under leaves. Our adulticides and larvicides largely get broken down by sunlight, so they're mostly sprayed at night or in the evenings. They also, because of the way they hide, aren't really very adept at aerial spraying. So if you fly over and dump a whole lot of some sort of substance on it, you just have to hope for the best that it's hitting either the mosquito, which is hiding, or the small body of water that it's breeding in. The one way we are able to use the spraying is more localized, and you see someone here with a handheld when we're in an area that we have issues where they can go around within the bushes and weeds during the day and trying to spray something more locally. But it's less effective than it would be for some other types of mosquitoes. Each of the type of mosquitoes that we deal with has a little bit of a different kind of control method. Particularly for Aedes aegypti and albopictus, it's destroying the breeding habitats. That's far and away the most important. So what would we do, and what do we do, when there is a case of Zika here in Orange County? And this goes for a travel-associated case. First, you have to suspect it in the first place, right? That's working with our medical community. So I mentioned before, Zika can be detected in blood or in urine. Anytime a physician sends off a test here in Central Florida to be tested for Zika, whether it's blood and urine, it's a mandatory requirement that they notify the Florida Department of Health every single time. Whenever the Florida Department of Health gets notified, that is considered a suspect case for us, all right? So the Department of Health then goes to that case and they begin 2 steps. They interview that individual. Where have you been? Have you been traveling? Have you been to a place that's endemic with this illness? They also look and try to confirm symptoms and make their own kind of file on the patient. They also notify the Mosquito Control, and that starts the process for us to try, before we even know if it's positive, to try to behave as though we know we have a case. So what happens then, if I can make a change, is this. So for every suspected case, every time that test is sent by a physician before we ever know if it's positive or not, the crews are given a map coordinate by the Department of Health, and we provide surveillance and abatement within 220 yards, so larger than that swath, than that circular area I showed you when we would expect the mosquitoes to travel. And we go to every single property in that area and start searching for breeding habitats and set traps and try to find out if the mosquitoes are there and get rid of them if we can. So we'll set traps, we'll locally spray if we think that it's reasonable to do so. We leave door hangers out that tell everyone we've been there. We don't tell them why, we just say Mosquito Control has been here. Make sure that you're looking for standing water, let us know if you see anything. We have it in multiple different languages now, English, Spanish, Creole, and Portuguese, and we leave them on the doors. We leave those traps and we come back in 24 hours. If we come back and the traps haven't caught any Aedes aegypti or albopictus, we consider ourselves in pretty good shape. If they have, we can send those mosquitoes to be tested for the Zika virus, and then we start the process all over again. So again, it's kind of a cycle, right? We get notified, we perform surveillance, we remove the habitats, we spray, we set traps, and then we come back and check on them. If there's nothing, then we're pretty good. If there is something, then we send those mosquitoes off and we start the cycle again. Usually it takes several days for us to get test results back on suspected Zika cases. By the time we have the result, whether someone does have Zika or not here in Orange County, their property and the properties within 220 yards of them has been surveyed and abated, and we're almost always very comfortable at that point that we've had a good control of the area. So I want to deploy some confidence in everyone that by the time you hear about these cases when they're out in the media, we've already been there doing this. So far, you can imagine this takes a lot of work, right? We've had 409, this is as of the 15th, 409 suspected cases. And because of those 409 cases since February, we have surveyed 10,000 properties. You can imagine, it's a lot of extra work. Of those 409 cases, only 52 of them have been positive for Zika. None of those have been local transmission. Every one of those 52 have been people who've traveled to endemic areas and come back here to Orange County, right? We've had no local transmission. We've also sent off about 1,500 different mosquitoes to be tested for the virus to see if any of our mosquitoes were carrying the virus and able to transmit it. So far, none of them have been positive either. So far, so good. We've also been one of the counties that have received some of the federal money that's been coming through the state down to areas that are affected by Zika. Thus far, we've received $124,000 in change. We've been spending that in ways that we feel are reasonable. But again, you can look at the amount of work that this takes and realize the importance of those bills right now in Washington and in Tallahassee when they talk about moving money, because for a well-resourced county, and we feel very well supported by the mayor and our Board of County Commissioners, we feel like we've got a good handle on this. But you can imagine there's lots of counties in the state of Florida that might not have these kind of resources. So We've also had a very proactive response communication-wise, and some of the people in this room may have already been a piece of that. We have been featured in, I've been told, close to 100 now media stories at this point. We also have on our website different PSAs and videos regarding Zika, and we've been trying to share that with everyone we can. And we've also been very active in social media, encouraging our community to dump standing water and protect themselves, wear barrier clothing, wear DEET. This is a really humongous aspect of this, and it's been a lot of work. We've also been engaging with our community as much as possible, going out and trying to educate trade groups and everyone else that might be affected by this. That includes the Central Florida Hotel and Lodging Association, the grounds crews. We had meetings with them, and we've continually met with grounds crews from other hotels, the professional landscaping companies throughout our area. We've worked with the EMS system. We've worked with police, with the airports. We've been working with Orange County Public Schools, and now even more recently, HOAs and neighborhood groups. Anything we can do to get the word out, particularly about getting rid of those breeding grounds and protecting yourself. We're also engaging now with Orange County staff, and I point this out because the people in this room represent a lot of large businesses with large staffs, and one of the great ways that we can actually get the message out is for all of us to look at our own businesses, our own companies, and say, most of our employees live and work right here in Central Florida. If we can get them not only to do the right thing where they work, but also at home, we're decreasing the risk of transmission here in total. So I encourage everyone to think about that when you think about your Zika response, how you would engage with your staff to protect them, but also everyone else around them. So what would happen if there was local transmission here in Orange County? And I want to reiterate, there has not been local transmission here in Orange County, but if there was, this would be the plan that we have in mind. So there's three different divisions of what would happen if this was the case. One of them is the public health sector, and that's overseen by the Florida Department of Health, and in the case of local transmission of Zika so far in Miami, also the Center for Disease Control at a federal level. The other is the operations side, and that's mosquito control. All right, and what we would do is activate the Emergency Operations Center here in Orange County at a low level so that we could utilize other resources that emergency management could offer us. And then there's the outreach and communications piece, and this would be spearheaded by Orange County's Communications Division, the Mayor's Office, and very likely Tallahassee and the Department of Health and their communications people. Mosquito control would increase surveillance. We would go door to door. We would set more traps. Obviously, we would be very, very engaged, hyper engaged in that local area where we had the local transmission. We would also utilize our Orange County Citizen Emergency Response Teams, HOA volunteers, and through the ESF8 function of the EOC, the Medical Reserve Corps. So we have this ability to engage in a number of people that will come help us be boots on the ground to go to this affected area and try to make sure we're wiping out all the breeding grounds and make sure everyone's involved in protecting themselves. The Department of Health would be doing that seroprevalence testing that they're doing right now in Wynwood area of Miami-Dade. They would start testing the contacts to the individual that was sick and going downstream and testing everyone they could to try to make sure that there was no one who was asymptomatic who was traveling outside of that area and potentially spreading it to other people. So they would be the major point of contact for any public health issues. They would also provide us access to property that we were having difficulty getting on because the Department of Health has the ability to do that in some cases where we cannot. And they would be coordinating very closely with mosquito control about where they felt we needed to be focusing our efforts. Orange County Communication would be organizing press releases, PSAs, media events to encourage community action, and working closely with folks like you, coordinating our message with the businesses here in Orange County. So what is the role that we hope for our businesses, our local businesses? I hinted at one of them, but I think it's important. We need to remain vigilant. We need everyone in this room and all of your businesses and everyone that you know to remain vigilant about removing these breeding habitats. Be very cautious about that. Another is that I think it's important to engage with your staff about preparedness. I talked about really the potential that we have with large organizations to utilize our own human resources to actually spread the message among your staff. Now that doesn't just help your business and the businesses around you, but also, again, when they go home, they're doing the right thing there too. And finally, collaborate with mosquito control. It's not really usually a problem with the businesses for us, but the reality of it is if we come there and we want to help, please let us on, let us help you, let us help any way we can, because it's very important for us to be able to provide that, and we're more than happy to provide any expertise that we can to you. We also want to make sure there's unified messaging, and I think at the end of this conversation we'll talk a little more about it. But I think it's important to know that at this point, Visit Orlando is going to be the point primary source when the questions from the media come regarding tourism and the businesses here. Orange County is going to lead when it comes to mosquito control and any operational things, and the Florida Department of Health would be the primary source for health concerns. So it's important that we make sure that everyone's on board with that to understand, so we keep this in the pathway that it needs to be. There are challenges to this if we have local transmission, we know that. One of them, from an operations perspective, is being able to maintain our regular operation despite the fact that we have this big event going on. We have seen our partners in South Florida have a massive increase in the number of constituents calling and asking for mosquito control to come to their property because now everyone's really upset and worried about it. It's true that that is a concern, but we also have several other types of mosquitoes that we're trying to abate at the same time. So while we focus on this, it becomes important for us to try to find ways to make sure we're maintaining our regular operations, and that's something Kelly and I have been talking about and we'll continue to talk about. We want to minimize the potential economic impact, and I think a lot of that comes from empowering our business partners and everyone here to join the mitigation effort, to be on the same page, to make sure that we're getting rid of breeding grounds and working together on our messaging. We also want to ensure the message reaches all of our residents and all of our visitors who come from nearby in the region. And we have to recognize that there are people that primarily communicate in different languages here that live here, and we're working to do the best we can to make sure that message gets out in multiple different languages, in multiple different avenues, so that everyone understands what they have to do. And finally, we need to collaborate with the entire Central Florida region. It's not lost on us that if there was local transmission in one of our neighboring counties, that would affect us almost as much, if not as much, as a local transmission here, because we are one region, and that's the way everyone sees it. So we are meeting with officials from our surrounding counties so that we can try to discuss how we share information and share best practices. Finally, I want to end on a couple of slides that are hopefully provide at least a little bit of optimism, right? So there is a low likelihood of a major outbreak of Zika here in the United States, and that has to do with a wide range of factors, not the least of which is the fact of where we live and how well we live as Americans, and we're lucky to be in the situation we're in. We do not have large slums, open-scale areas with no shelters and no air conditioning. Here in Orange County in Central Florida, much more likely what we have are people that have the ability to be behind screens at night, to have air conditioning, to not have an open house where mosquitoes can come in and out of. We have the ability to access insect repellents. We have a robust mosquito control program, which hopefully I have provided you some confidence in that. We also have synchronized public health agencies, and we have really much better access to OBGYN care. So when it comes to controlling this, it's much more likely that we would have small localized outbreak like we're seeing in South Florida right now than some widespread outbreak like we're seeing in some of the Latin American countries that are near us. Another reason to be confident is the fact that, again, the same mosquito carries two different viruses that we've been very concerned about for several years, dengue and chikungunya. And for years, we have been monitoring this and working it. And while dengue and chikungunya are endemic in many of the same areas, Zika has become endemic in South and Central America. What we have here in Florida are very rare, occasional local transmission cases and travel-associated cases without widespread outbreak. And it's for all these reasons I just told you right here. So there's every reason to have confidence that we would be able to throw resources at the problem. And that's why it's really important that we're all on the same page to do so. So where's the outlook for now? The CDC and the Department of Health have sent out guidance for testing and some travel warnings. The Department of Health sends their guidance out to physicians that work in their offices, in the hospitals, urgent cares, OBGYN physicians. They guide us, our community, and tell us when you suspect it, this is when you should suspect it, this is when you should send a test, this is when you shouldn't send a test. And that should help target us from going a little test crazy and testing everyone. At the same time, the governor just now agreed that the Department of Health is offering free Zika testing for any pregnant woman in the state of Florida. So that is going to muddy the waters a little bit for us on what we consider suspect cases and not suspect cases. And we're working very closely with our Department of Health locally to make sure that we're on the same page for who we're suspecting actually has it versus who is coming in because they're concerned and want to be screened, despite the fact that they have no symptoms and haven't traveled anywhere that would be a danger to have it. Aedes species control, we've gone over it again and again and again. This is very, very difficult. We have to engage our community. We all have to stay engaged. The difficulty will decrease as the summer months end, as we get into our drier season in a few months, but it doesn't go away completely. They just can't breed as fast. They still can breed year-round in Central Florida. And that might require boots on the ground, and we have plans in place if we need to get more resources for us to try to help get those boots on the ground in local communities. Finally, you may have heard of this, and I think it's important to talk about because here in the state of Florida, this is going to become something that gets talked about, I think, quite a bit in the coming months when they talk about the new methods of mosquito control. Our biggest fear in mosquito control is that these mosquitoes will develop tolerance to the materials that we use to try to abate them, and certainly that could happen, and there's laboratories at University of Florida that work exactly on that kind of research. But what's interesting, and probably more of an interesting political issue that has come up in the news a lot, are these genetically modified mosquitoes. So there is a company called Oxitec which developed a mosquito which genetically will pass on a gene that will not allow the larvae to survive unless they have a specific material that they need to ingest, which is not available in the regular environment. And what they have done and what they've shown in a couple of tests in South America is that if they release a large number of these male mosquitoes out into the environment, and male mosquitoes don't bite, by the way, it's only the females. If they release these, they will breed with the females. When the females lay their eggs, their larvae will not survive. And these mosquitoes only live for about 1 or 2 weeks. So if you continually flood the area with these type of mosquitoes that cannot breed successfully, over time you decrease the overall amount of these mosquitoes in the area. And they have shown this has successfully worked. Now, these just were recently FDA approved a few weeks ago, and the Florida Keys is suspected as one of the testing grounds for these mosquitoes. However, it's going to go to a vote to the local community to see whether they want to try this. It'll be interesting to see that. But here, just so you know, we are not in any way, shape, or form using GMO mosquitoes or in the future believing we're going to be. But we're all watching, and I think everyone who's intrigued by mosquito-borne illness is watching this because we're seeing this could be the next step in how you control against mosquito-borne illnesses. And I appreciate everybody listening to me, and thank you, Mayor Jacobs, for having me here.